Hello everyone and welcome. I'm Vaibhav Thakur with a background in B Pharma and M Pharma Pharmaceutics. Today I am excited to introduce you to our presentation titled How the Heart Works, the Engine of Life. In this session, we'll explore the fascinating functions of the heart, along with some key concepts in pharmacology, pharmacokinetics, and pharmacodynamics. We'll keep it engaging and informative, so let's get started. Let's take a moment to look at some of the major heart conditions that impact our health. We have myocardial infarction, commonly known as a heart attack, which occurs when blood flow to a part of the heart is blocked. Heart failure is another critical condition where the heart can't pump blood effectively to meet the body's needs. Arrhythmias refer to irregular heartbeats, which can sometimes be harmless but may also be life-threatening. Hypertension, or high blood pressure, is a major risk factor that can lead to many other heart problems. Understanding these conditions is key to recognizing the importance of heart health. Throughout this presentation, we'll explore how these diseases develop, how they can be prevented, and the treatments available to manage them effectively. Let's talk about the leading global cause of death, which is cardiovascular diseases. These are responsible for more deaths worldwide than any other health condition. It's staggering to think that every 33 seconds, someone somewhere loses their life to heart disease. That's a powerful reminder of how critical this topic is. Understanding the pharmacology, pathology, and therapeutics related to heart disease isn't just academic, it's essential. For pharma students and professionals alike, this knowledge forms the backbone of developing effective treatments and interventions. So why study the heart? Well, it's central to our survival, pumping blood and oxygen to every part of our body. When the heart or blood vessels go wrong, the consequences can be devastating. By delving into this topic, we're better equipped to make a real difference, whether through research, clinical practice, or developing life-saving drugs. In essence, studying the heart isn't just about understanding a vital organ. It's about tackling a leading cause of death and improving patient outcomes globally. It's a vital, impactful area of focus in medicine and pharmacology. The heart is approximately the size of your fist, which makes it a pretty compact but incredibly vital organ. Its weight typically ranges from about 250 to 300 grams, so it's not very heavy, but it packs a lot of function into that small space. In terms of location, the heart sits in the mediastinum, which is the central compartment of your chest cavity, nestled between the lungs. It's positioned just above the diaphragm, specifically on the superior surface of the diaphragm. Interestingly, about half of the heart lies to the left of the midsternal line, giving it a slight tilt to the left side of your body. Anatomically, the heart is situated in front of the vertebral column. That's behind it, and behind the sternum, which is the breastbone in the front. This positioning is crucial because it influences how the heart interacts with surrounding structures and how we approach it during medical examinations or procedures. Understanding the heart's location and size helps us appreciate just how efficiently it performs its role, pumping blood throughout the body, despite its relatively small size. It's a perfect example of form-meeting function in human anatomy. Let's take a closer look at the heart anatomy. The heart is a remarkable organ, essential for pumping blood and sustaining life. It consists of 4 chambers, 2 atria and 2 ventricles. The right atrium receives deoxygenated blood from the body, while the left atrium receives oxygenated blood from the lungs. These chambers then send blood to the ventricles, with the right ventricle pumping blood to the lungs for oxygen, and the left ventricle pushing oxygen-rich blood out to the rest of the body. It's also important to understand the valves within the heart, which ensure blood flows in the correct direction and prevents backflow. The main valves are the tricuspid, pulmonary, mitral, and aortic valves. These work together to coordinate the heartbeat and maintain efficient circulation. Overall, understanding the heart's structure helps us appreciate how it functions as a highly efficient pump, supporting the entire cardiovascular system and keeping us alive and active. The pericardium is essentially a double-walled sac that surrounds the heart, providing both protection and support. It's made up of 2 main parts, the superficial fibrous pericardium, which is tough and fibrous, and the deeper serous pericardium, which has 2 layers. The serous layer includes the parietal layer, which lines the inside of the fibrous pericardium, and the visceral layer, also known as the epicardium, which directly covers the surface of the heart. Between these 2 serous layers, there's a small space called the pericardial cavity, and it's filled with fluid. This fluid-filled cavity is crucial because it prevents friction as the heart beats and moves. The pericardium's main roles are to protect and anchor the heart in place within the chest. It also prevents the heart from overfilling with blood, which is vital for maintaining proper function. And, importantly, it allows the heart to work smoothly by providing a relatively friction-free environment, making sure that the heart's movements are efficient and unimpeded. Overall, the coverings of the heart, especially the pericardium, are essential for its protection and optimal performance within the thoracic cavity. The heart is truly a remarkable muscular pump that keeps blood moving through our entire body. So let's walk through how it works. Blood from the body enters the right atrium, which is low in oxygen. From there, the right ventricle pumps this blood to the lungs, where it picks up oxygen and gets rid of carbon dioxide. Once oxygen-rich blood returns to the heart, it enters the left atrium, coming from the lungs. The left ventricle then pumps this oxygenated blood out to the whole body, supplying all our organs and tissues with the oxygen they need to function properly. A key point here is how the valves work. They ensure that blood flows in only one direction, preventing any backflow that could disrupt the process. And behind the scenes, electrical signals coordinate this entire rhythm. The signals start at the sinoatrial node, or SA node, then move to the atrioventricular node, or AV node, and finally travel through the Purkinje fibers. This electrical pathway controls our heartbeat rhythm, keeping it steady and efficient. In short, the right side of the heart is responsible for receiving and sending blood to the lungs, where it gets oxygenated. The left side then takes over, pumping that oxygen-rich blood out to the entire body. On average, the heart beats around 72 times every minute, pumping about 5 liters of blood each minute. That's enough to circulate your entire blood volume multiple times a day. So, the heart is really the engine that keeps everything running smoothly. Let's walk through the blood flow pathway through the heart and body. It all starts in the body, where oxygen-depleted blood returns to the heart. From there, the blood enters the right atrium, or RA, which acts as a receiving chamber. When the RA contracts, it pushes blood into the right ventricle, or RV. The RV then contracts to send this deoxygenated blood to the lungs for oxygenation. Once in the lungs, the blood picks up oxygen and releases carbon dioxide. The now oxygen-rich blood returns to the heart, entering the left atrium, or LA. When the LA contracts, it pushes blood into the left ventricle, or LV. The LV is the main pumping chamber, and when it contracts, it sends oxygenated blood out through the aorta to supply the entire body. From there, the cycle repeats, ensuring our tissues get the oxygen they need to function properly. This pathway highlights the incredible efficiency of our cardiovascular system in maintaining life. Let's take a closer look at some of the major heart diseases that impact cardiovascular health. First, we have coronary artery disease, or CAD, which occurs when the arteries supplying blood to the heart become narrowed or blocked, leading to chest pain or even heart attacks. Hypertension, or high blood pressure, is another critical factor because it puts extra strain on the heart and arteries, increasing the risk of other conditions. Myocardial infarction, commonly known as a heart attack, happens when blood flow to a part of the heart muscle is suddenly cut off, causing damage or death of heart tissue. Then there's heart failure, a condition where the heart's ability to pump blood effectively is compromised, leading to symptoms like fatigue, shortness of breath, and fluid retention. Arrhythmias refer to irregular heartbeats, which can range from harmless to life-threatening, depending on their severity and type. Valvular disorders involve problems with the heart valves, which may cause blood to flow backward or reduce the efficiency of blood circulation. Congenital heart diseases are structural abnormalities present at birth that can affect heart function and require lifelong management. Overall, these major heart diseases form the core of cardiovascular health concerns. Understanding each of these conditions helps us appreciate the importance of prevention, early detection, and effective treatment in maintaining a healthy heart. Let's talk about coronary artery disease, or CAD. It's primarily caused by atherosclerosis, which is the buildup of plaques inside the coronary arteries. These plaques can narrow the arteries and limit blood flow to the heart muscle. Now, there are several risk factors that increase the likelihood of developing this condition. Smoking is a big one, as it damages the arteries and promotes plaque formation. High levels of LDL cholesterol, often called bad cholesterol, also play a major role. Diabetes, obesity, and chronic stress are additional factors that contribute to the development of CAD. When it comes to symptoms, patients often experience chest pain, which is also known as angina. Shortness of breath, or SOB, is another common symptom, especially during exertion when the heart isn't getting enough oxygen-rich blood. Diagnosing CAD involves a few key tests. An ECG, or electrocardiogram, can detect changes in the heart's electrical activity that suggest ischemia or past heart attacks. A lipid profile helps us understand the cholesterol levels, particularly LDL. Sometimes, an angiography is performed, where we use imaging to directly visualize the coronary arteries and identify blockages. As for treatment, the goal is to improve blood flow and reduce the risk of heart attacks. Statins are commonly prescribed to lower LDL cholesterol. Antiplatelet medications, like aspirin, help prevent blood clots from forming at the sites of plaques. In more severe cases, procedures like angioplasty, which involves opening blocked arteries with a balloon and often placing a stent, are performed. Understanding these aspects of CAD, its cause, risk factors, symptoms, diagnosis, and treatment, helps us better appreciate the importance of prevention and early intervention in managing heart disease effectively. Today, we'll be discussing what happens during a myocardial infarction, or a heart attack. It all begins with a complete blockage of a coronary artery, which is the blood vessel that supplies oxygen-rich blood to the heart muscle. When this artery becomes completely blocked, the affected part of the heart can't get the oxygen it needs, leading to tissue damage. The symptoms of a myocardial infarction often include radiating chest pain that may spread to the arms, neck, or jaw. Patients might also experience sweating and nausea, which are common signs that something serious is happening. In an emergency, prompt management is critical. The initial treatment approach is summarized as MONA, morphine to relieve pain, O2 to improve oxygen delivery, nitrates to dilate the arteries, and aspirin to thin the blood and prevent further clotting. This immediate response can be life-saving. Once stabilized, long-term management involves medications like beta blockers to reduce the heart's workload, ACE inhibitors to help relax blood vessels, and statins to lower cholesterol levels. These treatments are essential to prevent future cardiac events and improve overall heart health. Understanding these key points helps us appreciate the urgency and comprehensive approach needed when managing myocardial infarction. It's a condition where quick, coordinated care can make all the difference. Now let's talk about heart failure. Essentially, heart failure occurs when the heart's ability to pump blood is compromised. This means it can't pump enough blood to meet the body's needs. There are two main types: systolic heart failure, where the heart's pumping strength is reduced, and diastolic heart failure, where the heart can't fill properly. Patients with heart failure often experience symptoms like fatigue because the muscles aren't getting enough oxygen, edema, which is swelling usually in the legs or ankles, and breathlessness, especially during exertion or even at rest. In terms of treatment, we use various medications to manage these symptoms and improve heart function. These include ACE inhibitors and ARBs, which help relax blood vessels, beta blockers, which reduce the heart's workload, diuretics to remove excess fluid, and digoxin, which can strengthen the heart's contractions. Understanding these aspects of heart failure is crucial because it affects so many people worldwide, and managing it effectively can significantly improve quality of life. Now let's talk about irregular heartbeats, which are also known as arrhythmias. Some common examples include atrial fibrillation, or AF, ventricular tachycardia or VT, and bradycardia. These conditions involve abnormal electrical activity in the heart, leading to irregular or inefficient heartbeats. Dealing with arrhythmias can be complex, but there are several treatment options available. For instance, medications like amiodarone are often used to help stabilize the heart's rhythm. Beta blockers are another class of drugs that can slow down the heart rate and reduce arrhythmia episodes. In more severe cases, especially when the heart rhythm is dangerously irregular or slow, a pacemaker might be implanted. This device helps regulate the heartbeat and ensure it stays within a normal range. Overall, understanding and managing arrhythmias is crucial because they can significantly impact heart function and overall health. By recognizing these irregularities early and applying appropriate treatments, we can improve patient outcomes and help maintain a healthy, steady heartbeat. Let's talk about what's often called the silent killer. This is hypertension, or high blood pressure. When blood pressure exceeds 140/90 mmHg, it's considered high. Now, even though many people don't feel symptoms, it can cause a lot of serious health problems. It's a major risk factor for coronary artery disease, or CAD, strokes, and kidney disease. These are some of the leading causes of morbidity and mortality worldwide. In terms of treatment, there are several classes of drugs we use. Diuretics help the body get rid of excess fluid and lower blood pressure. ACE inhibitors and ARBs work by relaxing blood vessels, making it easier for blood to flow. Calcium channel blockers, or CCBs, also help relax and widen blood vessels. And beta blockers reduce the heart rate and the force of contraction, which lowers blood pressure as well. The key point is that managing hypertension is crucial because it's often asymptomatic, but can silently damage vital organs over time. Controlling blood pressure through lifestyle changes and medication can significantly reduce your risk of those major diseases we discussed. And that's why understanding and addressing hypertension is so important within the broader context of cardiovascular health. Let's take a closer look at the core drug classes. These are the main categories of medications that are used to treat various conditions, especially in the context of managing chronic diseases. Understanding these classes helps us see how different drugs work and how they fit into the overall treatment plan. Each class has unique mechanisms of action, side effects, and indications, which makes it important to recognize their differences. By mastering these core classes, we can better appreciate the role of each medication within the broader scope of patient care. This knowledge ultimately empowers us to make more informed decisions and provide more effective treatments. Now, let's talk about ACE inhibitors and ARBs, which are commonly used to lower blood pressure. These medications work by relaxing blood vessels, and they do this by blocking the formation or action of a chemical called angiotensin. Angiotensin is a substance that narrows blood vessels, so by inhibiting it, these drugs help vessels stay wider and easier to pass blood through. The key benefits of these drugs include reducing the workload on the heart, which is crucial for managing hypertension and preventing heart failure. They also lower systemic blood pressure, making it easier for the heart to pump blood. Additionally, in some patients, ACE inhibitors and ARBs help prevent kidney damage, which is a common concern with high blood pressure. Some common examples of ACE inhibitors are lisinopril and enalapril, while losartan and valsartan are popular ARBs. These medications are an important part of our toolkit for controlling blood pressure and protecting vital organs. Remember, their ability to relax blood vessels is a central part of how they help improve overall cardiovascular health. Let's talk about how beta blockers help reduce cardiac stress. Essentially, they work by blocking the effects of epinephrine, which is also known as adrenaline. When this happens, the heart beats more slowly and with less force, which lowers the overall workload on the heart. This is especially important in managing conditions like heart failure and after a person has had a heart attack. By doing so, beta blockers help significantly reduce blood pressure and decrease the oxygen demand of the heart muscle itself. This makes them a crucial part of the treatment plan for many cardiac patients. Some common examples of beta blockers include metoprolol, carvedilol, and bisoprolol. Overall, their ability to lessen cardiac stress not only helps improve heart function, but also plays a key role in preventing further damage and complications. So, in summary, beta blockers are vital medications that help control the heart's workload, making them indispensable in cardiac care. Let's talk about how calcium channel blockers work. These medications prevent calcium from entering the cells of the heart and blood vessel walls. By doing so, they promote relaxation of the vessels, which helps lower blood pressure and reduces the workload on the heart. Clinically, they are highly effective for treating conditions like high blood pressure, angina, which is chest pain, and certain types of arrhythmias or irregular heartbeats. Some common examples of calcium channel blockers include amlodipine, which you might know as Norvasc, diltiazem, called cardizem, and verapamil. Overall, these drugs play a vital role in managing cardiovascular conditions by relaxing blood vessels and improving blood flow. Preventing clot formation is a crucial part of managing cardiovascular health. Antiplatelet drugs play a key role here, especially in preventing arterial clots that can cause heart attacks and strokes. These medications work by stopping blood platelets from sticking together, which is essential because platelet aggregation is a primary step in clot formation. Now, when we talk about standard therapy, aspirin is the most common antiplatelet agent used. It's widely prescribed because of its effectiveness and safety profile. Besides aspirin, there are P2Y12 inhibitors, like clopidogrel, commonly known as Plavix and ticagrelor. These drugs are particularly important for patients who have stents placed or have a history of myocardial infarction, or MI, because they help prevent clot formation around the stent or in the coronary arteries. Overall, antiplatelet agents are a cornerstone in preventing cardiovascular events by keeping the blood flowing smoothly and reducing the risk of dangerous clots. Their use is vital in patients at high risk, helping to improve outcomes and save lives. Now, let's talk about anticoagulants, which are often called blood thinners. Unlike antiplatelets, these medications specifically target clotting factors in the blood, making them essential for preventing strokes, especially in patients with atrial fibrillation or artificial heart valves. When we look at the types of anticoagulants, we see two main categories. First, we have the traditional ones like warfarin, which requires regular monitoring of blood levels to ensure safety and effectiveness. Then there are the newer agents known as DOACs, direct oral anticoagulants, such as apixaban, also called Eliquis, and rivaroxaban or Xarelto. These newer drugs are a big step forward because they need less frequent monitoring and come with fewer dietary restrictions, making them more convenient for patients. So, in summary, anticoagulants play a vital role in blood clot prevention, and understanding the differences between traditional and newer options helps us choose the best approach for each patient. Statins are really the cornerstone of lipid-lowering therapy. They work by inhibiting the HMG-CoA reductase enzyme in the liver, which is a key step in cholesterol production. This action significantly reduces LDL, or what we commonly call bad cholesterol. Now, the clinical impact of statins is quite substantial. They help stabilize arterial plaques, which is crucial because unstable plaques can rupture and lead to heart attacks. They also reduce systemic inflammation, which plays a big role in atherosclerosis progression. Most importantly, numerous studies have shown that statins lower the risk of heart attack and stroke. When we talk about specific examples, drugs like atorvastatin, rosuvastatin, and simvastatin come to mind. They are some of the most commonly prescribed statins. Overall, statins are a fundamental part of cholesterol management, helping prevent serious cardiovascular events by targeting one of the root causes, high LDL cholesterol. Let's talk about the function of diuretics. Their main role is to promote the elimination of excess salt and water through urine. By doing this, they help reduce blood volume and lower blood pressure, which is essential in managing cardiovascular health. Now, why is this especially important? Well, for patients with heart failure, reducing fluid buildup, also known as edema, in the lungs and legs is absolutely critical. Excess fluid can make it harder for the heart to pump effectively and cause discomfort or breathing issues. There are different classes of diuretics, each with their own specific action. Loop diuretics, like furosemide, are very potent and act quickly. Thiazide diuretics, such as hydrochlorothiazide, are often used for milder cases or long-term management. And then we have case-bearing diuretics, like spironolactone, which help conserve potassium while still promoting water loss. Overall, diuretics are sometimes called water pills because of their role in helping remove extra fluid from the body. They're a cornerstone in treating conditions where fluid overload is a problem, especially in heart failure management. Let's talk about some of the advanced and emerging therapies for heart failure. First, SGLT2 inhibitors. Originally, these drugs were developed for diabetes management, but what's really remarkable is how they've shown significant efficacy in reducing hospitalizations for heart failure and even lowering mortality rates. It's a great example of how medications can have benefits beyond their initial purpose. Some key examples include dapagliflozin and empagliflozin. Next, we have ARNIs, or angiotensin receptor neprilysin inhibitors. These combine two different mechanisms to improve heart function. They help relax the blood vessels, which reduces the workload on the heart, and they also lower neurohormonal stress, which is a major contributor to heart failure progression. A notable example here is sacubitril/valsartan, marketed as Entresto. These therapies represent exciting advancements in our field, offering new hope for patients with heart failure by targeting different pathways and improving outcomes. They're part of a broader shift toward more innovative, tailored treatment strategies. Let's talk about immediate symptom relief with nitrates. These medications work by relaxing and widening the blood vessels, a process known as vasodilation. This helps blood flow more easily to the heart muscle, which is crucial during episodes of chest pain. The primary use of nitrates is to treat angina, providing quick relief from chest discomfort. They are often taken as a sublingual tablet or spray, which allows for rapid onset of action during an angina episode. One of the most common drugs in this category is nitroglycerin. It's important to remember that nitrates and vasodilators play a vital role in managing acute symptoms by improving blood flow quickly, making them an essential part of angina treatment. This connects to our overall theme of understanding how different medications help manage heart conditions effectively and promptly. Let's take a moment to review the key pharmacological treatments for some common cardiovascular diseases. For coronary artery disease, or CAD, the main first-line drugs are aspirin and statins. Aspirin helps prevent blood clots, reducing the risk of heart attacks, while statins are essential for lowering cholesterol levels and stabilizing plaques. Moving on to myocardial infarction, or MI, the primary treatments include thrombolytics and beta blockers. Thrombolytics are used to dissolve clots causing the blockage, and beta blockers help reduce the heart's workload and prevent further damage. In heart failure, or HF, we typically use ACE inhibitors or ARBs to help relax blood vessels and reduce strain on the heart, along with diuretics to manage fluid overload and alleviate symptoms. For hypertension, or HTN, the first-line options include calcium channel blockers, ACE inhibitors, and thiazide diuretics. These medications work through different mechanisms to lower blood pressure effectively. Finally, for arrhythmias, amiodarone and beta blockers are the go-to drugs. Amiodarone controls abnormal rhythms, and beta blockers help slow the heart rate and stabilize electrical activity. Overall, understanding these first-line drugs is crucial because they form the foundation of effective cardiovascular disease management, aligning with our broader goal of improving patient outcomes through targeted pharmacology. Let's talk about some key prevention and lifestyle strategies. First, avoiding smoking and moderating alcohol intake are crucial. These habits can significantly impact your heart health and overall well-being. Next, aim for at least 150 minutes of exercise each week. That could be anything from brisk walking to cycling, just enough to keep your body moving and your heart strong. Also, paying attention to your diet is vital. Focus on reducing salt and fat intake, which helps manage blood pressure and cholesterol levels. Speaking of which, managing conditions like high blood pressure, diabetes, and high cholesterol is essential. They're risk factors for heart disease, so staying on top of them makes a big difference. Overall, these lifestyle choices, avoiding harmful habits, staying active, eating healthy, and controlling medical conditions, are foundational to prevention. They not only lower your risk, but also promote a healthier, longer life. Let's talk about some warning signs that indicate when you should seek medical help immediately. First, if you experience chest pain that lasts longer than 10 minutes, that's a serious sign and you need to get help right away. Next, sudden breathlessness can be a sign of a critical issue, so don't ignore it. You should also be alert to palpitations, dizziness, or even fainting, as these can point to heart problems. Swelling in your legs is another key sign, especially if it's new or worsening, because it could indicate heart failure. Additionally, if you notice blue lips, this could mean your oxygen levels are dangerously low. Excessive sweating and restlessness are also warning signs that something's wrong. Remember, these symptoms are signals that your body is under stress or in trouble, and timely medical attention can be life-saving. Always err on the side of caution. If you experience any of these signs, seek help immediately. Let's take a moment to acknowledge some of the key references that inform our understanding and management of this topic. Harrison's Principles of Internal Medicine is a cornerstone resource, providing comprehensive insights into internal medicine practices. Goodman and Gilman's Pharmacology is essential for understanding the mechanisms of drugs and their therapeutic uses. Additionally, guidelines from global and national health organizations like the WHO, CDC, and AHA offer evidence-based recommendations that help shape clinical decision-making. These references not only support the information we've discussed, but also serve as valuable tools for staying current with evolving standards of care. It's important to recognize how these sources collectively guide us toward optimal patient outcomes and ensure we adhere to the latest best practices. Thank you so much for your time and attention today. If you found this presentation valuable, please like, share, or subscribe to Pharma Minutes to stay updated on future content. And if you have any questions or want the full presentation notes, feel free to comment below. Your engagement helps us improve and bring you more relevant insights. Once again, thank you for being here, and I look forward to connecting with you soon.